Mr. Brown, I think you have a problem with your heart. The problem is called angina pectoris. It's a Latin term. It's the pain that you get in your heart when it doesn't get enough blood or oxygen supply. Okay. It's a little like the pain you get if you drink a glass of ice water way too fast and you get that severe pain in the back of your throat, or the pain that you'd get if you make snowballs in the winter without gloves on. Or maybe the pain your wife may know about when you wash potatoes or radishes under the cold water faucet too long and your hands get very painful. Okay, those are all the same kind of pain when an area of your body doesn't get enough oxygen or blood supply. It's caused by blockages in the heart arteries, most likely related to cholesterol. Okay. There are lots of medications for this. There are ways to make you feel better. We have to sort what the best treatment is for you. Okay. First of all, I'd like to prescribe some medicines for you. It's very important that you take an aspirin every day. I'd like you to take a regular aspirin, or even better, a coated aspirin, because a coated aspirin is easier on your stomach. That acts as a blood thinner. Okay. People who have angina could have a heart attack if they have a blood clot in the area of the problem artery. Okay. And the aspirin will help thin your blood to keep that from happening. Okay. Most likely. Lots of doctors recommend aspirin for everyone over 45 years old to prevent heart attacks and strokes. A baby aspirin is good for nearly everyone, but for bigger people, sometimes it's not enough. So I would recommend either 2 baby aspirins, which is a half an aspirin, or 1 aspirin a day. Those are both excellent treatments. "81 milligrams is a quarter of a regular aspirin. A regular aspirin is 325 milligrams. So anything over 160 milligrams is fine. 2 baby aspirin or a regular aspirin. Okay. I'd also like to prescribe a medicine for you called nitroglycerin. I'll write it on a business card. Nitroglycerin is a tiny pill that you put under your tongue if you have the discomfort in your chest and it doesn't go away after 5 minutes. Okay? You put one under your tongue. You can wait 5 minutes and take another one if you're still having pain. You can take up to 3 nitroglycerin, but if you have pain after 3 nitroglycerin, you need to dial 911. Only if you have pain that doesn't go away. Okay. There are some side effects of nitroglycerin. You may get a headache. You may feel lightheaded. If that's the case, sit down or lie down. And you may feel some burning under your tongue when you take the medicine. Okay? I don't expect you to need to dial 911, but I tell everyone that I'm teaching about nitroglycerin about that, because if you know the rules of nitroglycerin, you will do well. I'd like to start you on another medicine that helps the chest pain, that helps you keep from getting the chest pain. It's called atenolol. I'll write it on the card. It's a medicine that lowers your heart rate, lowers your blood pressure, lowers the blood pressure, makes the heart use less oxygen, and helps prevent the chest pain. First, we have to find out what the problem is with your heart. Okay? And I'd like to schedule you for a stress test. This will be a special stress test where you walk on a treadmill and we take pictures of your heart by injecting a radioactive substance in your veins both at rest and during exercise. The radioactive substance is taken up in your heart muscle and we have pictures of your heart, of the circulation of your heart. That way we can tell what the best treatment would be for you. Some people do just fine on medicines. Have you had friends or family who have had an angiogram or angioplasty? An angiogram is a test where we look at the heart arteries by taking pictures of a clear liquid that shows up on X-ray as it goes through the heart arteries. Okay, this happens in the hospital. If there's a large area of your heart that is involved, then we would send you to the hospital where, after putting numbing medicine in your groin area, they would give you medicine to relax, and they would run small plastic tubes up the aorta into the heart arteries. It doesn't hurt. Once that intravenous line is in, you don't feel anything. Most people find it pretty interesting, actually. Right. You get to watch, you don't. You can see the pictures afterwards. Okay. After the angioplasty, they may be able to use a balloon to open up those arteries. And possibly use a stent. Did you ever play with bamboo handcuffs when you were a kid? Finger handcuffs? Those toys? It's just like that, but it's made of metal. They put that in the heart artery and blow up a balloon, blow it up with a balloon, and it holds the artery open and helps it to heal. It stays there. Hopefully, in most instances, it will stay open. Some people have scarring in the stents, and that can be treated with another balloon. Because the artery is partially closed from cholesterol buildup, the cholesterol problem. We're also going to be sending you for a blood test to check your cholesterol levels again. Okay. And you may benefit from medicines for cholesterol. Okay? So we have a lot of information. We have prescriptions for 2 new drugs, the atenolol, which you take every morning, the nitroglycerin that you use under your tongue only if you have pain that doesn't go away in 5 minutes. What type of insurance do you have? That would be fine. I'm sure they're covered. You will probably have to pay a copay, whatever your standard copay would be. Okay, and the aspirin I'm going to ask you to buy as well. Okay. You'll have the... Well, I'm writing it out for you. Okay, the blood test for cholesterol. And the nurses will help schedule that stress test for you. Exactly. We'll try to do that in the next week. And we'll make an appointment to see me after that stress test. Okay. It's a lot of information. I have it written down here. And the office number is here. If you have questions, please call, and the nurses will help answer any questions. And I'm available at that number as well if you need to talk to me. Okay? Do you have any questions or concerns? Are you able to do light duty? Okay. Would a 30-pound weight load be possible? Okay. Great. We'll fill that out. Okay. Remember, if you have pain that doesn't go away with nitroglycerin, between now and the visit, you'll dial 911. Perfect. Perfect. Anything else we can help you with? Okay. Good to meet both of you.